Now, with global technological advances, it is crucial for industry leaders in healthcare to remain unwavering when it comes to ethics. There's a danger that decisions based on the influence of technology could blur the lines of what is acceptable in the sector and what the best outcomes should be for patients. For more on this, we're joined by Dr. Nivisha Parag, Head of Healthcare Management Studies at Regent Business School. Dr. Parag, thank you so much and good morning to you. Just looking at ethical leadership and the technology also playing a role in it. What does the study show in how the lines could potentially be blurred when it comes to ethical leadership in the sector?
Thank you very much, and good morning to you, Cindy. Good morning to all the viewers, and thanks for having me on the show. So certainly, if you look at how you define ethical leadership itself, it's defined as the practice of upholding strong moral principles and promoting ethical behavior in all aspects of leadership. So certainly, when doctors commit offenses of this nature, and when patients try to coerce practitioners into prescribing sick notes when they're unwarranted, etc., they are certainly compromising their integrity. And being an ethical leader, these people differentiate themselves by others by maintaining such integrity, by committing themselves to accountability and fairness and justice. And they show empathy and compassion. And in these kinds of decision making, they become ethical role models and look at the long-term orientation and implications for organizations, for their patients, and for other stakeholders involved. So they set themselves apart by earning the trust and credibility required in this environment. They create inclusive environments, and they shun away from being unethical and lacking integrity in their decisions and their practices. So they consider the well-being of the broader community, and they make choices that align with their own values.
So, Dr. Parag, we're not really talking about a family physician who knows you, from generation to generation, has been in the family, where you could potentially say, on an odd day, I'm not quite feeling myself, can you book me off? Is that in itself corrupting the practitioner, as it were?
So having a good relationship with your family physician is not necessarily corrupting the physician or his practice. It depends on one's own moral values, number one. But this kind of behavior between a practitioner and their patients builds trust, and it promotes honesty and transparency. And certainly sometimes people need mental health care days. People need days of time to rest and recoup. And sometimes their only way out of a difficult situation might be a sick day. Obviously, within reason and with correct judgment, family practitioners can make this call. However, there are times when family practitioners charge vast amounts of money for sick notes, and there are very much known family practitioners out there that you pay a certain amount and you'll get a sick note without any justification. That is unethical behavior.
Okay, I just want to touch on life esidimeni, which probably would be the most obvious example of how catastrophic decisions are made impacting the lives of vulnerable patients. Would that be a case in point where we say this is unethical, there's no accountability, and there's impunity when it comes to the wrong decision making?
Certainly. And the most important thing here, Cindy, is that ethical leaders don't shy away from admitting when they've made an error, and they understand that accountability is essential for maintaining trust and credibility. So they embrace the responsibility, and they demonstrate humility and willingness to grow. By covering up for errors and by failing to make amends, they are failing to improve on future actions and improvements in the sector. So it's important to encourage continuous personal and professional development. And talking by experience and from experience of my own colleagues in the sector, it is always easier and more morally sound to actually admit to a mistake or an error, be it in decision making, be it in the clinical realm of your workplace or anything else, rather than covering up for errors that have been made. And by by listening to stakeholders and seeking outside perspectives, you can start to show genuine concern for well-being, even when errors do occur. When there's unintended consequences, it is much easier to validate an error that has occurred rather than to cover up for some devious behavior.
And speaking of devious behavior, Dr. Parag, there's also been reports of bogus doctors, albeit some that may not have complied with their renewal license fees, etc. But there has been cases of doctors operating both in the public and private sector who have no business being there in the first place. So that doesn't bode well for the sector, does it?
Not at all, Cindy. And thankfully, the Health Professions Council of South Africa is clamping down hard on these kind of bogus doctors, as we call them. There are a number of unregistered healthcare professionals practicing in the country, and the Health Professions Council is now seeking out these individuals, deregistering them, and ensuring that all practitioners have the appropriate qualifications and registrations and recognitions to practice safe healthcare in the country. And it's so important, because this ethical decision making and being able to weigh consequences of actions on patients, on the community, and the environment at large is what ethical leaders need to seek by demonstrating that they've evaluated potential risks and harms associated with different options. And there's no room for bogus doctors and any other healthcare professionals that have been banned from practicing in this very challenging and dynamic sector that deals with people's lives.
Now, so as we look at leading the healthcare revolution ethically, we also have to empower patients, because there had been cases of malpractice or misdiagnoses, and people don't have any recourse in what it is that they can do. So with this study and also encouraging more ethical leadership, how do we empower patients? Can you walk into a practitioner if you're not familiar with them and request their qualifications,
Certainly, I think healthcare consumerism is on the rise, where people are taking charge of their own healthcare. There's social media technologies that are available widely and easily and freely available, with sound, safe information and accurate information for people to seek backgrounds of their practitioners, to seek backgrounds of the facilities they are attending, as well as to seek further information about the conditions and the treatment plans that are being offered to them. So I think patients in general should be empowered and should be educated about their own health and well-being. And part of promotive and preventive health care is by providing such information to patients at any opportunity, be it come.
Yeah, do you have that agency, though, when you are in a public healthcare sector that is under pressure and, nurses and staff being overworked? As a patient, do you really have that personal agency?
It's very difficult to say yes to that question, Cindy. I think the public sector, where the priority is trying to attend to as many patients as possible, and with language barriers and various other challenges, it is difficult to say that we have such agency in place. However, in the primary healthcare realm, where we're trying to boost and uplift our primary healthcare sector, where it is the first point of contact for all people, this is where that education and promotive healthcare and knowledge about one's own health and well-being should start. And hopefully, with this move towards universal healthcare coverage, we can start to improve on that and empower everybody to take charge of their own health. It's important because now more than ever before, as we're facing these transitions in the country, leaders are faced with difficulties, including communication with patients, but also things like a dilapidated infrastructure, which we tend to call hospitals, and a lack of access to care for numerous amounts of people. And then the insurmountable costs, to name just a few. And as we endeavor to implement universal health coverage in South Africans, here now more than ever is ethical leadership particularly important to make an impact on the lives of people and their well-being.
Dr. Parag, thank you so much indeed for your time. I really appreciate it. We're speaking to Dr. Nivisha Parag.